Following a group therapy session, a client approaches the nurse and verbalizes a need for seclusion because of uncontrollable feelings. The nurse reports the findings to the charge nurse and expects that the charge nurse will take which action? A. Call the client's family. B. Place the client in seclusion immediately. C. Inform the client that seclusion has not been prescribed. D. Get a written prescription from the healthcare provider and obtain an informed consent. Answer is D. Get a written prescription from the healthcare provider and obtain an informed consent. Rationale: a client may request to be secluded or restrained. Federal laws require the consent of the client, unless an emergency situation exists, in which an immediate risk to the client or others can be documented. The use of seclusion and restraint is permitted only on the written prescription of the healthcare provider, which must be reviewed and renewed every 24 hours, depending on state law requirements. It must also specify the type of restraint to be used. The nurse is providing care to a client admitted to the hospital with a diagnosis of anxiety disorder. The nurse is talking with the client, and the client says, "I have a secret that I want to tell you. You won't tell anyone about it, will you?" Which is the appropriate nursing response? A. No, I won't tell anyone. B. I cannot promise to keep a secret. C. If you tell me the secret, I will tell it to your doctor. D. If you tell me the secret, I will need to document it in your record. Correct answer is B. I cannot promise to keep a secret. Rationale: the nurse should never promise to keep a secret. Secrets are appropriate in a social relationship but not in a therapeutic one. The nurse needs to be honest with the client and tell the client that a promise cannot be made to keep the secret. A client with delirium becomes agitated and confused at night. The best initial intervention is which of the following? A. Move the client next to the nurse's station. B. Use a night light and turn off the television. C. Keep the television and a soft light on during the night. D. Play soft music during the night and maintain a well-lit room. The correct answer is B. Use a night light and turn off the television. Rationale: it is important to provide a consistent daily routine and a low-stimulation environment when the client is agitated and confused. Noise levels, including a radio and television, may add to the confusion and disorientation. Moving the client next to the nurse's station is not the initial intervention. Which nursing interventions are appropriate for a hospitalized client with mania who is exhibiting manipulative behavior? Select all that apply. A. Communicate expected behaviors to the client. B. Enforce rules and inform the client that he or she will not be allowed to attend therapy groups. C. Assist the client in developing means of setting limits on personal behavior. D. Follow through about the consequences of behavior in a non-punitive manner. F. Be clear with the client regarding the consequences of exceeding limits set regarding behavior. Correct answers are A. Communicate expected behaviors to the client. C. Assist the client in developing means of setting limits on personal behavior. D. Follow through about the consequences of behavior in a non-punitive manner. And F. Be clear with the client regarding the consequences of exceeding limits set regarding behavior. Rationale: interventions for dealing with the client exhibiting manipulative behavior include setting clear, consistent, and enforceable limits on manipulative behaviors, being clear with the client regarding the consequences of exceeding limits set, following through with the consequences in a non-punitive manner, and assisting the client in developing means of setting limits on personal behaviors. Enforcing rules and informing the client that he or she will not be allowed to attend therapy groups are violations of a client's rights. The nurse observes that a client is psychotic, pacing, and agitated, and is making aggressive gestures. The client's speech pattern is rapid, and the client's affect is belligerent. Based on these observations, the nurse's immediate priority of care is which? A. Provide safety for the client and other clients on the unit. B. Provide the clients on the unit with a sense of comfort and safety. C. Assist the staff in caring for the client in a controlled environment. D. Offer the client a less stimulating area to calm down and gain control. The correct answer is A. Provide safety for the client and other clients on the unit. Rationale: safety of the client and other clients is the priority. Option A is the only option that addresses the client and other clients' safety needs. Option D addresses the client's needs. Option B addresses other clients' needs. Option C is not client-centered. Nurse is caring for a client diagnosed with catatonic stupor. The client is lying on the bed, with the body pulled into a fetal position. The appropriate nursing intervention is which? A. Ask direct questions to encourage talking. B. Leave the client alone and intermittently check on him. C. Sit beside the client in silence and verbalize occasional open-ended questions. D. Take the client into the day room with other clients so they can help watch him. The correct answer is C. Sit beside the client in silence and verbalize occasional open-ended questions. Rationale: clients with catatonic stupor may be immobile and mute and may require consistent, repeated approaches. The nurse facilitates communication with the client by sitting in silence, asking open-ended questions, and pausing to provide opportunities for the client to respond. The nurse would not leave the client alone. Option D relies on other clients to care for this one, which is an inappropriate expectation. Asking direct questions of this client is not therapeutic. Option C is the best action because it provides for client supervision and communication as appropriate. A mother of a teenage client with an anxiety disorder is concerned about her daughter's progress on discharge. She states that her daughter stashes food, eats all the wrong things that make her hyperactive, and hangs out with the wrong crowd. In helping the mother prepare for her daughter's discharge, the nurse should suggest which? A. The mother should restrict the daughter's socializing time with her friends. B. The mother should restrict the amount of chocolate and caffeine products in the home. C. The mother should keep her daughter out of school until she can adjust to the school environment. D. The mother should consider taking time from work to help her daughter readjust to the home environment. The correct answer is B. The mother should restrict the amount of chocolate and caffeine products in the home. Rationale: clients with anxiety disorder should abstain from or limit their intake of caffeine, chocolate, and alcohol. These products have the potential of increasing anxiety. Options 1 and 3 are unreasonable and are an unhealthy approach. It may not be realistic for a family member to take time away from work. A client has reported that crying spells have been a major problem over the past several weeks, and that the doctor said depression is probably the reason. The nurse observes that the client is sitting slumped in the chair, and the clothes that the client is wearing do not fit well. The nurse interprets that further data collection should focus on which? A. Weight loss. B. Sleep patterns. C. Medication compliance. D. Onset of the crying spells. The correct answer is A. Weight loss. Rationale: all the options are possible issues to address, however, the weight loss is the first item that needs further data collection because ill-fitting clothing could indicate a problem with nutrition. The client has already told the nurse that the crying spells have been a problem. Medication or sleep patterns are not mentioned or addressed in the question. The nursing student is developing a plan of care for the hospitalized client with bulimia nervosa. The nursing instructor intervenes if the student documents which incorrect intervention in the plan. A. Monitor intake and output. B. Monitor electrolyte levels. C. Observe for excessive exercise. D. Monitor for the use of laxatives and diuretics. The correct answer is C. Observe for excessive exercise. Rationale: excessive exercise is a characteristic of anorexia nervosa, not bulimia nervosa. Frequent vomiting, in addition to laxative and diuretic abuse, may lead to dehydration and electrolyte imbalance. Monitoring for both dehydration and electrolyte imbalance is an important nursing action. Option 3 is the only option that is not associated with care of the client with bulimia. The nurse is caring for a female client who was recently admitted to the hospital for anorexia nervosa. The nurse enters the client's room and notes that the client is doing vigorous push-ups. Which nursing action is appropriate? A. Interrupt the client and weigh her immediately. B. Interrupt the client and offer to take her for a walk. C. Allow the client to complete her exercise program. D. Tell the client that she is not allowed to exercise vigorously. The correct answer is B. Interrupt the client and offer to take her for a walk. Rationale: clients with anorexia nervosa are frequently preoccupied with vigorous exercise and push themselves beyond normal limits to work off caloric intake. The nurse must provide for appropriate exercise as well as place limits on vigorous activities. Potassium chloride intravenously is prescribed for a client with hypokalemia. Which actions should the nurse take to plan for preparation and administration of the potassium? Select all that apply. A. Obtain an intravenous infusion pump. B. Monitor urine output during administration. C. Prepare the medication for bolus administration. D. Monitor the IV site for signs of infiltration or phlebitis. E. Ensure that the medication is diluted in the appropriate volume of fluid. The correct answers are A. Obtain an intravenous infusion pump. B. Monitor urine output during administration. D. Monitor the IV site for signs of infiltration or phlebitis. And E. Ensure that the medication is diluted in the appropriate volume of fluid. Rationale: potassium chloride administered intravenously must always be diluted in IV fluid and infused via an infusion pump. Potassium chloride is never given by bolus. Giving potassium chloride by IV push can result in cardiac arrest. The nurse should ensure that the potassium is diluted in the appropriate amount of diluent or fluid. The IV site is monitored closely because potassium chloride is irritating to the veins and there is risk of phlebitis. In addition, the nurse should monitor for infiltration. The nurse monitors urinary output during administration and contacts the healthcare provider if the urinary output is less than 30 ml per hour. A client with atrial fibrillation is receiving a continuous heparin infusion at 1,000 units per hour. The nurse determines that the client is receiving the therapeutic effect based on which results: A. Prothrombin time of 12.5 seconds. B. Activated partial thromboplastin time of 60 seconds. C. Activated partial thromboplastin time of 28 seconds. D. Activated partial thromboplastin time longer than 120 seconds. The correct answer is B. Activated partial thromboplastin time of 60 seconds. Rationale: common laboratory ranges for activated partial thromboplastin time are 30 to 40 seconds. Because the activated partial thromboplastin time should be 1.5 to 2.5 times the normal value, the client's activated partial thromboplastin time would be considered therapeutic if it was 60 seconds. Prothrombin time assesses response to warfarin therapy. The client is being treated with procainamide for a cardiac dysrhythmia. Following intravenous administration of the medication, the client complains of dizziness. What intervention should the nurse take first? A. Measure the heart rate on the rhythm strip. B. Administer prescribed nitroglycerin tablets. C. Obtain a 12-lead electrocardiogram immediately. D. Auscultate the client's apical pulse and obtain a blood pressure. The correct answer is D. Auscultate the client's apical pulse and obtain a blood pressure. Rationale: signs of toxicity from procainamide include confusion, dizziness, drowsiness, decreased urination, nausea, vomiting, and tachydysrhythmias. If the client complains of dizziness, the nurse should assess the vital signs first. Although measuring the heart rate on the rhythm strip and obtaining a 12-lead electrocardiogram may be interventions, these would be done after the vital signs are taken. Nitroglycerin is a vasodilator and will lower the blood pressure. A client with a clot in the right atrium is receiving a heparin sodium infusion at 1,000 units per hour and warfarin sodium 7.5 milligrams at 5 p.m. daily. The morning laboratory results are as follows: activated partial thromboplastin time 32 seconds, international normalized ratio 1.3. The nurse should take which action based on the client's laboratory results? A. Collaborate with the HCP to discontinue the heparin infusion and administer the warfarin sodium as prescribed. B. Collaborate with the HCP to obtain a prescription to increase the heparin infusion and administer the warfarin sodium as prescribed. C. Collaborate with the HCP to withhold the warfarin sodium since the client is receiving a heparin infusion, and the activated partial thromboplastin time is within the therapeutic range. D. Collaborate with the HCP to continue the heparin infusion at the same rate, and to discuss use of dabigatran etexylate in place of warfarin sodium. The nurse is monitoring a client who is taking digoxin for adverse effects. Which findings are characteristic of digoxin toxicity? Select all that apply. A. Tremors. B. Diarrhea. C. Irritability. D. Blurred vision. E. Nausea and vomiting. The correct answers are B. Diarrhea, D. Blurred vision, and E. Nausea and vomiting. Rationale: digoxin is a cardiac glycoside. Toxicity can lead to life-threatening events, and the nurse needs to monitor the client closely for signs of toxicity. Early signs of toxicity include gastrointestinal manifestations such as anorexia, nausea, vomiting, and diarrhea. Subsequent manifestations include headache, visual disturbances such as diplopia, blurred vision, yellow-green halos, and photophobia, drowsiness, fatigue, and weakness. Prior to administering a client's daily dose of digoxin, the nurse reviews the client's laboratory data and notes the following results: serum calcium, 9.8 mg per deciliter, serum magnesium, 1.0 milliequivalents per liter, serum potassium, 4.1 milliequivalents per liter, serum creatinine, 0.9 mg per deciliter. Which results should alert the nurse that the client is at risk for digoxin toxicity? A. Serum calcium level. B. Serum potassium level. C. Serum creatinine level. D. Serum magnesium level. Correct answer is D. Serum magnesium level. Rationale: an increased risk of toxicity exists in clients with hypercalcemia, hypokalemia, hypomagnesemia, hypothyroidism, and impaired renal function. The calcium, creatinine, and potassium levels are all within normal limits. The normal range for magnesium is 1.3 to 2.1 milliequivalents per liter, and the results in the correct option are reflective of hypomagnesemia. A client being treated for heart failure is administered intravenous bumetanide. Which outcome indicates that the medication has achieved the expected effect? A. Cough becomes productive of frothy pink sputum. B. Urine output increases from 10 milliliter per hour to greater than 50 milliliters hourly. C. The serum potassium level changes from 3.8 to 3.1 milliequivalents per liter. D. B-type natriuretic peptide factor increases from 200 to 262 picograms per milliliter. The correct answer is B. Urine output increases from 10 milliliters per hour to greater than 50 milliliters hourly. Rationale: bumetanide is a diuretic, and expected outcomes include increased urine output, decreased crackles, and decreased weight. Intravenous heparin therapy is prescribed for a client. While implementing this prescription, the nurse ensures that which medication is available on the nursing unit. A. Vitamin K. B. Protamine sulfate. C. Potassium chloride. D. Aminocaproic acid. The correct answer is B. Protamine sulfate. Rationale: the antidote to heparin is protamine sulfate. It should be readily available for use if excessive bleeding or hemorrhage should occur. Vitamin K is an antidote for warfarin sodium. Potassium chloride is administered for a potassium deficit. Aminocaproic acid is the antidote for thrombolytic therapy. Clinic nurse is providing instructions to a client with hypertension who will be taking captopril. Which statement by the client indicates a need for further instruction? A. I need to change position slowly. B. I need to avoid taking hot baths or showers. C. I need to drink at least 4 quarts of water daily. D. I need to sit down and rest if dizziness or lightheadedness occurs. The correct answer is C. I need to drink at least 4 quarts of water daily. Rationale: captopril is an ACE inhibitor. Orthostatic hypotension can occur in clients taking this medication. Adequate fluid is important, but 4 quarts of water daily could actually aggravate the hypertension. Clients are advised to avoid standing in one position for long periods, to change positions slowly, and to avoid extreme warmth such as with baths, showers, or heat from the sun in warm weather. The client should be instructed to monitor for signs of orthostatic hypotension, such as dizziness, lightheadedness, weakness, and syncope. Methylergonavine is prescribed for a woman to treat postpartum hemorrhage. Before the administration of methylergonavine, the nurse should check which priority item: A. Uterine tone. B. Blood pressure. C. Amount of lochia. D. Deep tendon reflexes. The correct answer is B. Blood pressure. Rationale: methylergonavine, which is an ergot alkaloid, is an agent that is used to prevent or control postpartum hemorrhage by contracting the uterus. Methylergonavine causes continuous uterine contractions and may elevate the blood pressure. A priority before the administration of the medication is to check the blood pressure. The healthcare provider should be notified if hypertension is present. Although options A, C, and D may be components of the postpartum data collection procedures, but option B is related specifically to the administration of this medication. The nurse is monitoring a preterm labor client who is receiving magnesium sulfate intravenously. The nurse should monitor for which adverse effects of this medication. Select all that apply. A. Flushing. B. Hypertension. C. Increased urine output. D. Depressed respirations. E. Extreme muscle weakness. F. Hyperactive deep tendon reflex. The correct answers are A. Flushing, D. Depressed respirations, and E. Extreme muscle weakness. Rationale: magnesium sulfate is a central nervous system depressant, and it relaxes smooth muscle, including the uterus. It is used to stop preterm labor contractions, and it is used for preeclamptic clients to prevent seizures. Adverse effects include flushing, depressed respirations, depressed deep tendon reflexes, hypotension, extreme muscle weakness, decreased urine output, pulmonary edema, and elevated serum magnesium levels. A pregnant client is receiving magnesium sulfate for the management of preeclampsia. The nurse determines that the client is experiencing toxicity from the medication, if which is noted on data collection. A. Proteinuria of 3+. B. Presence of deep tendon reflexes. C. Serum magnesium level of 6 milliequivalents per liter. D. Respirations of 10 breaths per minute. The correct answer is D. Respirations of 10 breaths per minute. Rationale: signs of magnesium sulfate toxicity relate to the central nervous system depressant effects of the medication, and include respiratory depression, a loss of deep tendon reflexes, and a sudden drop in the fetal heart rate, maternal heart rate, and blood pressure. Therapeutic serum levels of magnesium are 4 to 7.5 milliequivalents per liter, or 5 to 8 milligrams per deciliter. Proteinuria of 3+ is likely to be noted in a client with preeclampsia. Epidural analgesia is administered to a woman for pain relief after a cesarean birth. The nurse assigned to care for the woman ensures that which medication is readily available if respiratory depression occurs. A. Betamethasone. B. Morphine sulfate. C. Naloxone. D. Meperidine hydrochloride. The correct answer is C. Naloxone. Rationale: opioids are used for epidural analgesia. An adverse effect of epidural analgesia is a delayed respiratory depression. Naloxone is an opioid antagonist, which reverses the effects of opioids and is given for respiratory depression. Morphine sulfate and meperidine hydrochloride are opioid analgesics. Betamethasone is a corticosteroid that is administered to enhance fetal lung maturity. Proimmune globulin is prescribed for a woman after the delivery of a newborn infant, and the nurse provides information to the woman about the purpose of the medication. The nurse determines that the woman understands the purpose of the medication if the woman states that it will protect her next baby from which condition? A. Having Rh-positive blood. B. Developing a rubella infection. C. Developing physiological jaundice. D. Being affected by Rh incompatibility. The correct answer is D. Being affected by Rh incompatibility. Rationale: Rh incompatibility can occur when a Rh-negative mother becomes sensitized to the Rh antigen. Sensitization may develop when a Rh-negative woman becomes pregnant with a fetus that is Rh-positive. During pregnancy and at delivery, some of the baby's Rh-positive blood can enter the maternal circulation, thus causing the woman's immune system to form antibodies against the Rh-positive blood. The administration of Rho immune globulin prevents the woman from developing antibodies against Rh-positive blood by providing passive antibody protection against the Rh antigen. With preeclampsia is receiving magnesium sulfate, which indicates to the nurse that the magnesium sulfate therapy is effective. A. Scotomas are present. B. Seizures do not occur. C. Ankylosing is noted. D. The blood pressure decreases. The correct answer is B. Seizures do not occur. Rationale: for a client with preeclampsia, the goal of care is directed at preventing eclampsia. Magnesium sulfate is an anticonvulsant, rather than an antihypertensive agent. Although a decrease in blood pressure may be noted initially, this effect is usually transient. Scotomas are areas of complete or partial blindness. Visual disturbances, such as scotomas, often precede an eclamptic seizure. Ankylosing indicates hyperreflexia and may precede the onset of eclampsia. Ergonovine is prescribed for a client with postpartum hemorrhage. Before administering the medication, the nurse should question administration of the medication, if which condition is documented in the client's medical history. A. Hypotension. B. Hypothyroidism. C. Diabetes mellitus. D. Peripheral vascular disease. The answer is D. Peripheral vascular disease. Rationale: methylergonovine is an ergot alkaloid that is used to treat postpartum hemorrhage. Ergot alkaloids are avoided in clients with significant cardiovascular disease, peripheral vascular disease, hypertension, eclampsia, or preeclampsia, because these conditions are worsened by the vasoconstrictive effects of the ergot alkaloids.